Welcome to South Georgia Career Center's Medical Assistant class, Chapter 5, Circulatory System. Contents in this chapter are: Anatomy of the circulatory system, Pulmonary circulation, Systemic circulation, Coronary circulation, Closed cardiovascular system, Heart, Blood vessels, Blood oxygen transport development, Arterial system, Venous system. Common medical conditions: atherosclerosis, edema, hemorrhage, thrombophlebitis. Circulatory system. Anatomy of the circulatory system. The circulatory system passes nutrients, like electrolytes and amino acids, hormones, gases, blood cells to and from the cells within the body, in order to fight disease, maintain homeostasis, and stabilize pH and body temperature. The circulatory system consists of pulmonary circulation, systemic circulation, coronary circulation, closed cardiovascular system, and the heart. Pulmonary circulation. The pulmonary circulation carries oxygen-depleted blood from the heart to the lungs and returns oxygen-enriched blood to the heart. Blood, oxygen-deprived, enters the right atrium. This blood, now taking on oxygen, travels through the tricuspid valve into the right ventricle and from there pumped into the pulmonary arteries that go to the lungs. Pulmonary veins return the blood, now oxygen-rich, to the heart, entering the left atrium. From the left atrium, this oxygen-rich blood flows through the mitral valve into the left ventricle. The aorta, artery, now pumps oxygen-rich blood from the left ventricle out into the body. Systemic circulation. The systemic circulation carries oxygen-rich blood from the heart to the body and returns oxygen-deprived blood back to the heart. If measured in length, systemic circulation is much longer than pulmonary circulation, as it transports blood to every part of the body. Coronary circulation. The coronary circulation provides the blood supply to the heart. Closed cardiovascular system. This system is called closed because the blood does not leave this structure of blood vessels. Oxygen and nutrients in the closed cardiovascular system spread out across the layers of blood vessels and enter the so-called interstitial fluid, which carries that oxygen and the nutrients to the target cells, and waste and carbon dioxide the opposite way. Heart. The heart is the organ that pumps oxygen-deprived blood to the lungs and oxygen-rich blood to the body. For each circulation, the heart has one atrium and one ventricle. The right atrium is the upper chamber of the heart's right side. Blood that is moved into the right atrium is oxygen-deprived and moved into the right ventricle in order to be pumped by the pulmonary artery to the lungs in order to be oxygen-enriched. The left atrium receives this oxygen-enriched blood from the lungs and the pulmonary veins and is then moved into the left ventricle in order to be pumped by the aorta to other body organs. Blood vessels. Blood vessels transport blood throughout the body and are divided into three types: arteries, capillaries, and veins. Arteries carry blood away from the heart. Capillaries enable the exchange of water as well as chemicals between blood and tissues. Veins carry blood from the capillaries back to the heart. Blood oxygen transport. The lungs are the organs where the exchanges of oxygen and carbon dioxide between the air and blood take place. Oxygen enters the lungs through each inhalation, breathing in. Carbon dioxide exits the lungs through each exhalation, breathing out. This exchange takes place within the lungs' alveoli, air sacs. Each of the alveoli is surrounded by pulmonary capillaries. Alveoli walls and pulmonary capillaries walls are lined with semi-permeable membranes. The membranes allow the circulation of oxygen gas into the capillary bloodstream and for the circulation of carbon dioxide gas out of the pulmonary capillary bloodstream. Each inhalation brings a new supply of oxygen to the lungs, whereas the blood flowing through the lungs is oxygen deprived. For that reason, an increased concentration of oxygen is inside the alveoli and a decreased concentration of oxygen is in the bloodstream. The increased concentration of oxygen in the alveoli is circulated into the bloodstream. Each red blood cell contains the substance that carries oxygen, called hemoglobin. Each hemoglobin carries 4 oxygen molecules. Blood takes on oxygen as it passes the alveoli. The oxygen then binds to the hemoglobin within the red blood cells. As blood passes through the lungs, it increases its oxygen concentration. The oxygen-enriched blood passes through the circulatory system to supply other organs. In the systemic capillaries, the oxygen spreads from the blood into the tissues. The tissues then use this oxygen for metabolic activities. Peripheral tissues release carbon dioxide. In the peripheral tissues, the carbon dioxide level is high but decreases in the blood. A small part of the carbon dioxide stays in its form in the blood. A larger part of the carbon dioxide enters the red blood cells where it bonds with hemoglobin. Once bonded, the carbon dioxide is turned into bicarbonate. Blood has now decreased levels of oxygen and increased levels of carbon dioxide. The blood now moves from the systemic capillaries to the pulmonary capillaries. In the pulmonary capillaries, the carbon dioxide levels are increased in the blood and lower in the alveolar air space. Carbon dioxide spreads from the blood into the air space. The bicarbonate is turned into carbon dioxide in the lungs and spreads into the air space. The carbon dioxide molecules now separate from hemoglobin and enter the alveolar space. Development. Arterial and venous systems develop from different areas. The arterial system mainly develops from aortic arches, whereas the venous system develops from 3 bilateral veins between 4 to 8 weeks of the development of a human. Arterial development. The arterial system develops from the aortic arches as well as the dorsal aorta at 4 weeks of human development. Aortic arch 1 mostly moves back and forms the maxillary arteries. Aortic arch 2 mostly moves back as well and forms the stapedial arteries. Aortic arch 5 completely moves back. The formation of the arterial system comes from the aortic arches 3, 4 and 6. The dorsal aorta first are bilateral and later fuse to form the definitive dorsal aorta. There are about 30 posterolateral branches that branch off the aorta and form the intercostal arteries, the lumbar arteries, the upper and lower extremity arteries, and the lateral sacral arteries. The lateral branches from the aorta form the suprarenal arteries, gonadal arteries, and renal arteries. The ventral branches from the aorta are the vitelline and the umbilical arteries. The vitelline arteries form the superior arteries, inferior mesenteric arteries, and the celiac arteries of the GI tract, gastrointestinal tract. The umbilical arteries form the internal iliac arteries after birth. Venous development. The venous system mainly develops from the umbilical veins, the cardinal veins as well as the vitelline veins. Umbilical veins, vitelline veins, and cardinal veins empty into the sinus venosus. Common medical conditions. The following contains information about some of the different medical conditions of the circulatory system. Atherosclerosis. Disorder of arteries characterized by buildup of fatty deposits, such as cholesterol, cellular debris, or lipids, on the artery's inner wall. As these fatty deposits may harden, they can eventually block the arteries. Causes may include diabetes, a non-communicable disease where the blood has high levels of sugar, high-fat diet, obesity, high blood pressure, or family history. Symptoms can include chest pain, slurred speech, and/or numbness in the arms or legs. Diagnosis can be made upon physical examination or intravascular ultrasound and/or CT scans. Treatment may include cholesterol medications, beta blocker medications, or antiplatelet drugs. Edema. Edema is a condition of swelling which is caused by too much fluid in body tissue. Appears most commonly in feet and legs. Edema can be a result of other medical conditions such as heart failure or kidney disease. Symptoms include swelling of the tissue and/or stretched skin. Chest X-ray, Blood and urine tests can help identify this condition. Treatment usually involves treating the underlying cause and can include medications, hemorrhage, condition of blood loss from blood vessels. Causes may be traumatic or medical. Traumatic causes may include abrasion, puncture wound, or incision. Medical causes may include intravascular changes and/or extravascular changes. Treatment may include direct pressure to wounds or cold applications to reduce blood flow, thrombophlebitis, swelling or inflammation of veins/or veins caused by a blood clot. Blood clots are clumps that occur as blood hardens from a liquid to solid and coagulate, form clot. Causes may include major surgery or sitting for long periods of time. Symptoms include inflammation/swelling of the affected region, pain in the affected region, tenderness of the vein, or skin redness. A physician may be able to diagnose the condition by examining the affected area. Treatment may include antibiotics, analgesics, and/or NSAIDs.